A very good afternoon, dear viewers. This is the Big Topic Show with your host, Emanuela. Today, I'm having experts with me right here when it comes into community mobilization towards accessing SRH services. And so maybe they can get to introduce themselves to us, and then we move forward with our topic. Thank you so much. You're most welcome.
Thank you, Emma. I'm Nakalembe Fatuma. Nice to be here.
Thank you so much, Nakalembe. Yes, dear.
Oh, thank you, Emanuela. I'm Norman. I'm happy to be here.
All right, we've all heard who they are, and moving forward to our topic of today, we are going to have a lot of interactions with them when it comes into, I told you these are experts when it comes into community mobilization. And when you ask me what SRHR is, we're going to maybe get more of the information from our guests of today. These are experts, so please tune into this and get to listen to them when it comes into accessing these services. Okay, moving forward, I would love to hear from you your experiences when it comes into doing community mobilization. What has been your experience like with the community people when it comes into accessing the services, more so like the abortion services?
Thank you very, very much, Emma. One, I would like to take this opportunity to thank our viewers. Thank you for watching Coherinet TV. As Coherinet, we are happy to share about community mobilization. Working with different people from the grassroots communities has been a pleasure for us as Coherinet. And I would say it is not something very easy to work with people from the communities. There are different challenges we go through as us, because you find different people with different cultures, with different religion, with different beliefs. So in these communities, it is a community comprising of different environments and different people with different perceptions. So mobilizing them, bringing them together for one cause or a similar cause sometimes becomes harder, mostly when you're talking about abortion. Being that abortion is something people take to think it's illegal, it is restricted, it is not allowed, it's an abomination, it makes it more harder for people to talk about it openly in these communities. But as Coherinet, we've maneuvered and made sure that we pass on this information to these people from the different communities.
Okay, well, so let's hear from our gentleman here. How was it being for you, getting to do mobilization now? You look young, and so I'm sure, how is it when it comes into the young people? How is your experience like mobilizing them to access these services?
Thank you so much, Emanuela. When it comes to mobilization, mostly when you talk about abortion, it's a very sensitive issue. So now, and community mobilization is very dynamic. We find a lot of challenges here and there. And we look at the topic we tackle as Coherinet, abortion, sexual reproductive health. But let me just discuss the other wing of abortion. In many communities, they tend to perceive it in a bad way, according to personal beliefs and norms. And then the other people will perceive us in a positive way. But again, I realize that the more we talk about something, the more we find solutions for the problem. And the less we talk about fear, to talk about abortion, we're keeping hiding. A lot is happening behind our backs. Young people are dying, they are getting pregnant, and they are not finding solutions for the problem they have. So we look at raising the voice, raising awareness in the community, make people know that how much you get pregnant, you can't take care of it, at least you can do something. Even if in the case of, let's say, you have got a miscarriage, it's something that happens, we call it spontaneous abortion. It happens on its own. You lose the pregnancy. Still, you can seek service, you can be helped. That makes our work very easy. We don't stop because of the challenges, but we learn from the challenge, and then we keep on moving and further and further.
Okay. Well, you've really been, that is so good of you doing that. And I would really love to know what are some of those challenges, like from your interactions with these people, what have they got to maybe bring out? What do you think are some of the challenges that makes them not to access these services, given the fact that you've talked about the religious bit of it, and then the cultural kind of the norms and the beliefs that we have in the communities? How have you been able to, what are some of those things, and how have you been able to overcome them, or how have you been able to, make this people to be able to access the services regardless of the beliefs and the norms in the communities?
Thank you, Emma. One of the biggest challenges that we found in these communities is stigma. And stigma is divided in three. Institutional, we have the individual, we have the community stigma, which comes back when I say an individual stigma. This is the stigma where an individual stigmatizes herself. Let me say, I, Fatuma, I have an unwanted pregnancy, and I feel like I want an abortion, but I start stigmatizing myself. Okay, in case I have an abortion, how will people see me? That's individual stigma. So we also have a problem of institutional, where we have the unclear laws. We have these stakeholders who are not supportive, who are mixing both individual perception and the law, making it hard for these young people to access these services. Then we have the general community, where these communities stigmatize these young people. And they're like, okay, this person has had an abortion, she should leave our community, making these young people to be in fear. The other problem we've experienced with these young people is cost. Some of these young people are complaining so much about the abortion costs for abortion services. In some communities, abortion services are so very expensive that this young person cannot afford to have that service. So most of them end up going to unsafe abortion, because it's cheaper to buy tea leaves and have these services than going to a hospital, according to their perception. But as Coherinet, we've tried to sensitize them about dangers of unsafe abortion. Despite of the cost, yes, there are some measures you can utilize. You can talk to Auntie Kaki, toll-free hotline. You get some counseling. You get some referrals in case you need a service. But in other areas, we've observed there is delay in service provision among service providers, where these young people go for these services and reach there. The service provider is like, I'll come tomorrow, I'll work on you tomorrow, I'm busy, I'm not there. And when it comes to young people, it becomes worse, where these young people are even stigmatized by the providers. You've come for the service, which pulls them back to a certain extent, making them fear to even go to these facilities.
Okay.
Yeah.
Well, gentlemen, what do you think?
Thank you so much. Again, looking back at what Nakalemba said, when it comes to the challenges, we have many. We have the individual challenges, like, and can score them, like, let's say, provider challenges, and also like the consumer challenges. Let's say, for a case of, these cases of abortion and self-abortion, they always tend to happen in people that are vulnerable. And now I'm looking at young people. But again, as going to make them know that vulnerability is not weakness. But again, it's a brave step to growth. So by talking to them, we gave them that courage that they can take bold decisions as young people, that they can access the service in case they need it. Also, there's also a challenge of lack of contraceptives. When we don't have these things like, let's say, the condoms, the post-abortion, like the post-pills, you may end up getting pregnant after having sex. But in case these things are provided, these people can overcome that challenge. At least you can prevent, than again waiting to cure the other bigger severe thing. So talk about that. In case you get pregnant today, you have an abortion, at least try to have that, what you call abortion, family planning. After abortion, you have to get that contraception that will help you prevent you from getting pregnant again. That pregnancy you don't really want. So you try to talk to them one-on-one. You also engage them in the peer-to-peer approach. One person has got a problem, so you can share your story to the rest, and then you can sensitize, the rest can learn from you as young people. You can see that in the end is that attitude change and transformation among those young people.
Okay.
Again, to add
Yes.
on what Norman has said, we encourage them to use the peer-to-peer approach, but as well we engage them in VCAT sessions, where we take them through this value clarification and attitude transformation to transform their attitudes.
I was just about to ask you what VCAT is, but then luckily enough you've let me know. Okay. Yeah.
Yes, so we try to transform their attitudes towards abortion as well as post-abortion contraceptives. Yes, in case this has happened, please, at least next time, you can have a contraceptive after an abortion. Because in most cases, when a woman has had an abortion, they easily conceive very easily. So we even talk about the post-abortion contraceptives. And not only the VCAT sessions, we also have the crossing the line sessions. These are harm reduction sessions. We want to stop the harm before it happens. So we take them through these processes to prepare them. In case, okay, this happens, where do you run to? In case this happens to a friend, in case you hear about it somewhere, what happens? What is next? Yes.
Well, we've talked about a lot of challenges affecting the young people and the community in general. I heard you talk about something to do with the pricing. So, so many times people get to fear the prices being high, and being that our communities are so vulnerable, and given the young people, the levels of unemployment is so high in our country, so with the current economy, people really get to have that, that heart of like, they get to have that challenge. Yes. So you, as the community champions, what have you done to help these people so that they really don't get to go for our the roots of the plants and all that? Yes. What have you put in place?
Thank you, Emma. As Coherinet, we've done so much. One, we've given out voucher systems where someone can reach out to us and get a service through our voucher system at a free cost. Secondly, we've taken these services closer to far to reach areas where these women can easily access these services despite they have money, despite they don't have money. Thirdly, we've trained these providers and partnered with these facilities where they are providing these services at a free cost, and or even sometimes at a reduced cost. Yes.
Well, so you mean if I want right now, let's say if I want an abortion, I can straight away go to a facility and get it for free? Or how about the providers whom you said, sometimes someone might want to reach out to a facility, and then I come and then they tell me, how about the provider you say tells the client to come tomorrow? So what have you done on their end? The services may be there for free, yes. So what?
Emma, if you want a post-abortion care service, you can reach out to us and get it at a free cost. Yes.
Okay.
Where you can get the free cost post-abortion care services, we also have our toll-free numbers coherent. When you call those toll-free numbers, we shall direct you. When you do this work of mobilization, just looking at not people who have money, but also we are not trying to not leave any stone unturned. People who don't have money, people who have money, they cannot be accommodated when it comes to this. Those that have money cannot go to access services from the Lydia Partner clinics. They can get the family care, family planning they want, the post-abortion care they want. Even those without money, they can also link up to the public facilities, get free services of all the need they want.
Okay, so meaning from what I've got, we have public facilities that you're liaising with. Oh, okay. All right, then. Thank you so much. We are still on the Big Topic Show. Let's have a short break. We shall be back with our show of today. Welcome back from that short break. We are continuing with the Big Topic Show. I still have my experts here with me. And yes, going back to our last topic of the discussion, we were yet discussing about, you talked about the challenges. And then Mr. Norman, you mentioned about the knowledge gap among the community people. So yes, what have you done to make sure that these people really are knowledgeable about the existence of these services, or maybe about abortion care in general?
Learning doesn't end, it has no limit. So in this, when you talk about abortion, we engage community, like let's say the influencers, the providers, the local leaders, so that they can talk openly about abortion. By this, they will be throwing awareness on our behalf to the public about abortion, where people can know, when I have a problem, I can run to this and that, and this is how I can manage the problem. Also, going on, still we also involve the trainings of the providers, the healthcare providers, in case they receive clients who want to access abortion care services. How can they handle them? How can they deal with them? With that willingness to work on them, and so that they can receive their desired services. Yes.
Okay. Thank you so much, Mr. Norman. Yes, Madam Nakalembe, do you have something to add when it comes into bridging the knowledge gap among the community people?
Yes. In most cases, as Coherinet, we do sensitize these people in categories. Let me say we have young people, we have adolescents, we have adult women. As we are packaging our community mobilization information, we package it according to a particular target group. And that the information suits that particular target group in regards to the topic would like to pass on to those people. Yes.
Well, thank you so much about that. Then one thing I quoted you saying is, you talked about the distance. Okay, so I want to know, what have you done? What, as being experts, what have you done? Because I know you're ensuring that these people really get to have access to these services. What have you done?
Okay, thank you, Madam Emma. Let's start with your area. You said you come from
Koboko.
Koboko. So, okay, according to some of the challenges you guys face in Koboko, is distance part of it?
Yes, sure. Yeah.
It's part of it. Okay. As Coherinet, what we've done, we've taken services closer through activations with these private facilities. So we take these services closer even to those far-to-reach areas so that these people can easily access these services. Yes.
Okay, well, given in my neighborhood, there is Yumbe, okay? There is Yumbe, and then given the religious bit of it, it's a place that is having people who are so religious. And now, given your area of operation, how have you been able to, maneuver with my people that side?
Your people are hard and complicated, but as Coherinet, being that we are expert in community mobilization, we've brought together different strategies to see that we bring these stakeholders on board. Yes, we've put together different strategies, different approaches, and we've put them on board. It has really helped us to create that long-lasting relationship and easy our work with hard-to-reach people and complicated people, like people from Yumbe.
Oh, okay. So, Mr. Norman, yes, what do you have to say about that? What have you people done in the areas of Yumbe?
Let's say for the case of Yombe, we also bring these services close to people in terms of, like, I can say, like, when you have our social media handles, we keep on updating, posting, giving information to people, so people can use the internet so they can learn something. Let's say Facebook, Twitter, you can still learn something from Coherinet, what is happening in the community, and you can also access services through that. Yes.
Okay, well, moving forward, I would love to really know, now it being that you've been interacting with these people in the communities, do you really think these people are aware about these services, or they are aware about having, that right to their bodies? Is it the case? What is it? What have you experienced when it comes into that?
According to our experience in these communities, so many women and young girls don't know that they have a right to health or to these services. So it has been through our strategies and our interventions that we are making these women and girls to get to know about their rights. I can even start with you. Do you know you have a right in regards to seeking an abortion service?
What, me?
Yes.
You know that you have a right to have sex or not to have sex? You know that?
So this is, so I have a right to have sex or not to have sex?
We are asking you, do you have a right?
That you have a right to have sex?
That I'm just hearing about today. So yes, tell me more about it.
Yes, we all have rights in regards to health, and they're mandatory to everyone. I have a right to decide when I want to give birth and when to have sex with anyone. You have the same right. So many women, young girls out there do not know that they have these rights. They believe it's a man to decide for you. They believe it's not your body. They believe, okay, my husband has said I should give birth till he tells me he's tired. But at the end of the day, it's your body, it's your right, it's your health to decide. Yes.
Okay, yes, Mr. Norman.
Yes, for sure, these people, they're not really that they have those rights. But however, sometimes a problem will become a problem after there is demand for the attention to that problem. So before someone is pregnant, they will not know that there is a problem. But once someone gets pregnant when he is not ready to have that pregnancy, that's when there is need to attend to that problem. That's when they will know that have to get away to fight over this, to overcome this. So we try to make them know you have a right to your body. When to have a baby and when not to have what? A baby. And how you can know about this. So we try to inform them in our different strategies, make them understand they have the rights to their bodies. Most especially the girls in schools, those that are out of schools. That's what we do.
And we not only talk about that, but we empower these girls about their right to reproductive health. You have a right to make any decision in regards to uptake of any reproductive health service. So we empower them to have that right to their bodily autonomy. You have a right to decide. It's your body at the end of the day. You have a right to decide, okay, this is my body. I can do this with my body. Yes.
Well, this has been a very interesting topic. At least I've really learned that I have a right to to have sex or not to have sex. But then, all in all, it's up to us to know that we have rights to our bodies and we have rights to sexual reproductive health services. And so I'm sure there is someone out there who was not aware that they really do have rights to their bodies. And so please, this has really been a very helpful topic for us today. I really urge you to come back again and have more discussions with us, because we need such kind of discussions. Someone like me doesn't even know that I had this right. But then I'm sure that someone out there at least now has this information that they do have rights to their bodily autonomy and to do whatsoever they want to do with their body. But then it all comes into you to make a choice. So please, I urge all of us to reach out to Coherinet. They talked about having a toll-free helpline, that is anti-khaki sexual reproductive health toll-free helpline. Well, this has really been an interesting topic for today. Please continue coming in and letting us know more about this when it comes into your services. But before we roll out for today's show, could you be having any last remarks that you want to give to our viewers?
Yes, I do. Our dear viewers, kindly keep on following us at Coherinet at X, Coherinet on Instagram, Coherinet on YouTube, as well as TikTok. Kindly follow our social media platforms for all kinds of information in regards to SRHR.
Okay, yes, Mr. Norman, what do you have to say?
Thank you so much, our viewers, for being with us. What I can tell you is that our toll-free numbers are open and they're for free. You can call Anti-Khaki at any time and you get help. Our numbers are 0800 247 247 and also 0800 347 347. You can also still reach us on WhatsApp. Anti-Khaki WhatsApp is 0741 90 17 82. There you can get Anti-Khaki. You can ask any question about sexual reproductive health and you'll be helped. For referrals, for information, anything, you'll be helped by Anti-Khaki. Thank you so much.
All right, thank you so much, our guests of today. It has really been so interesting to have you around. Still with you, your host for today, Emanuela, on the Big Topic Show. Thank you so much for being with us. Don't touch your dial. We still have very many other shows coming on next. Thank you for loving us. Coherinet TV.